Does remission means cancer is completely cured? Not always. In oncology, remission has different types and every type tell us something different about the patient response to the treatment. First, let us understand what is the meaning of remission. So, remission simply means that the cancer has responded to the treatment. The sign and symptoms have either reduced or disappeared. But remember, remission does not always means the cancer is cured. It simply means the disease is under good control or cannot be detected with the tests being used. Now, let us understand the types. Complete remission means that after the treatment, doctor cannot find any evidence of cancer. The patient has no symptoms or signs, and scans or routine tests do not show any detectable diseases. However, this does not always guarantee that every single cancer cell has disappeared. Some microscopic cells may still remain. Partial remission means the treatment has worked, but the cancer has not disappeared completely. For example, a tumor shrink by more than half after chemotherapy, but is still present. So we call it partial remission. So the disease is much better, but not completely gone. Molecular remission. Now, this is much deeper level. Sometimes, even when scans look normal, doctor use highly sensitive molecular tests to search for the tiny amounts of cancer. And if these tests also cannot detect cancer, it is called molecular remission. And this means the cancer is undetectable even with advanced molecular techniques. MRD negativity, minimum residual disease negative. So this is one of the most sensitive way to check remission, especially in blood cancers. MRD stands for minimum residual disease. So doctor use technique like flow cytometry or PCR to look for even a single cancer cell among hundred of thousands or even million normal cells. If no cancer cells are found, the patient is called MRD negative. This is considered an excellent treatment response and is associated with better prognosis. Cytogenetic remission. This type is mainly used in leukemia. So some leukemias have specific chromosome abnormalities like Philadelphia chromosome in chronic myeloid leukemia. So after treatment, doctor check the chromosomes using tests such as karyotyping or FISH. If those abnormal chromosomes are no longer detected, the patient has achieved cytogenic remission. Radiological. This simply means that imaging tests like CT scan, MRI, or PT scan do not show any visible cancer, and this type of remission is commonly used in solid tumors, where doctors mainly depend on imaging to assess the risk.